Hi everyone, I'm Dr.ALEENA PAUL, UPSC 2022 batch. I'm currently working as a doctor in Indian Railways. So I'm going to talk regarding the UPSC CMS exam, the UPSC Combined Medical Service exam. I'll read how I prepared for the exam, what the exam's really like, and maybe some insider tips regarding working as a doctor through UPSC CMS. So what is UPSC CMS exam? As you all know, this is basically an exam conducted by Public Service Commission to select doctors into various government services. Upon joining, you will be working either in Category 1 or Category 2. Category 1 includes CGHS, Central Government Health Service. You will be working as medical officers here. Category 2 includes 3 posts. First one is the post of ADMO, Assistant Divisional Medical Officers in Indian Railways. I am currently working in that. And in the second post is GDMO, General Duty Medical Officer in New Delhi Municipal Corporation. And third one is the role of GDMO in Municipal Corporation of Delhi. Before diving further, let's get to this question. UPSC CMS versus NEET PG. I know most of you must be thinking, is this question even comparable? And I know for sure that most of your answer will be NEET PG. That is the most common pathway, the most sought out pathway. But for a few minutes, I'm really trying to convince you to at least give this exam a try. I have few reasons for that. 1. Syllabus advantage. UPSC CMS focuses on 5 core clinical subjects: medicine, pediatrics, OBG, surgery and PSM. This syllabus overlap makes sure that you are not distracting yourself from your NEET PG prep. You can at least treat UPSC CMS as a mock exam before original NEET PG. 2. Dual opportunity. If you clear both UPSC CMS and NEET PG, UPSC allows you to postpone your joining for 3 years to finish your NEET PG training. So this will essentially gives you an extra government job opportunity after your NEET PG. If you want, you can take it. If you don't want, you can drop it. No extra pressures. I always think that having an extra opportunity is worth it. 3. Safety net scenario. If you don't get your desired branch or desired rank for NEET PG, UPSC CMS can be your safety backup. You can work in a government job with decent salary for your next year of NEET PG prep. Some services like railways offers DNB seats after 2 years of service. After 5 years of service, you are eligible for service quota in premium institutes like AIIMS. I know it's not a replacement for NEET PG if specialization is a dream, but it is a strategic parallel path. Maybe a good one at that. Hopefully, I have convinced at least a few of you. Now let's discuss about this exam. This selection process has mainly 2 stages. Stage 1, written exam carrying 500 marks, and stage 2, personality interview carrying 100 marks. First, written exam. It is an MCQ based exam containing 2 papers. Each paper will have 120 questions and you will get 120 minutes to finish the exam. So paper 1 will be from morning 9:30 am to 11:30 am. It consists of around 90 questions from general medicine and 30 questions from pediatrics. There can be some questions from dermatology and psychiatry, but the number will be very less. You can expect around 2 to 3 questions at the max. Then you'll have your lunch break. Second paper will be from 2 p.m. to 4 p.m. It consists of 40 questions from surgery, 40 questions from PSM and 40 questions from OBG. As mentioned above, there can be some questions from ortho, anesthesia, ENT, ophthalm, etc. But the number will be very less. As you can see, this is a very lengthy exam, so you need to sustain your attention. Now let's discuss some common queries. The most common query is this exam easy? No, it is not. It is actually a difficult paper. But as compared to NEET PG, the competition level is much less. Another common query is that will there be any current affair questions? No, you just need to focus on your clinical subjects. Now let's discuss about the preparation strategy. You don't need any special books for UPSC CMS prep. Like as many of you will be already preparing for NEET PG from your coaching platforms, those notes are more than sufficient. You need to focus on 5 core clinical subjects: medicine, pediatrics, OBG, PSM and surgery. If you are well versed in these subjects, then you can easily pass this exam. Try to practice last 6 years paper. There is no need to go further than that, as there was a syllabus change after that. Previous year topics tend to get repeated, so please practice the last question papers. Now, I personally feel that subjects like PSM and OBG can give you a good edge. Many topics like TB, anemia management in pregnancy, and national health program tends to get repeated every year. If you are well prepared, you can easily crack this exam. After you are shortlisted, then you need to send your DAF, detailed application form. Now the next question, what is DAF? It collects detailed information about you regarding your personal details, your academic backgrounds and your service preferences. Will there be any questions from DAF for your in-person interview session? Yes, there can be. The chair may ask you something from your DAF, like your hobbies or some other personal details. The questions will be simple, straightforward, but at least you should remember what you have written in that. Now, one common query for many people, which service to choose? It depends on your personal preference. If you want work-life balance, then maybe CGHS is a better option. There is work-life balance in both cases, but still in CGHS, as there is only OPD, the working hours is more scheduled. You don't need to be present after that. In railways, there will be IPD duties. You may need to attend if there is any emergencies. You need to attend the train course, etc. So there is more of a casualty duty period. So there is more duties in case of the railway doctors. So if you prefer more work-life balance, CGHS is the best bet, followed by MCD, NCDS and then railways. If you prefer urban postings, then again CGHS is the best option. If you want to take DNP seats after 2 years of service, then you need to choose railways. If you want to be posted in Delhi itself, then MCD or NCDS is the best option. But the number of vacancies in that MCD and NCDS is very low. But still, you can give a preference in that order. If you are working in railways, then you will get additional railway passes, and the colonies are much more well maintained in case of railways. And I think if you are joining as a specialist, then railway gives you more opportunity to do your specialist work, as there are IPDs, OTs and all those facilities. Maybe it's a better option if you are joining after your specialization. Now that you are done with all these steps, comes the step that most people are afraid of, personality interview. But there is nothing to worry about. It carries about 100 marks. Your interview panel consists of 5 members. The chair will be an IAS officer and the rest 4 will be specialist doctors. For example, for my interview, the panel consisted of an IAS officer, a physician, a surgeon, a gynecologist and pediatrician. There can be other subject experts like from PSM, Ophthal, ENT, Ortho, etc. Your panel will be a permutation of any subject. For interview, you may be asked general knowledge questions, but it will be somewhat related to health. For example, for my interview, as I mentioned that I was from Kerala, they asked me regarding the infant mortality rate of my state and the government policies which helped in attaining that. There can be questions about telemedicine, online consultation, etc. But even if you don't know the answer, there is no need to worry. Just don't bluff, say that you don't know the answer and they will move on to the next question. As for preparing for interview, brush up your basics. Revise clinical fundamentals, revise regarding your health programs. There can be questions based on the fundamentals. They don't go into the advanced facts. There can be questions testing your situational awareness, like how to handle emergencies, or questions regarding management of MI, snake bite, dog bite, etc. Just checking your awareness in a situation. And body language matters a lot. Maintain eye contact. Confidence matters as much as knowledge. Remember, this interview is about you, your attitude, your awareness, your commitment. Stay calm, stay genuine. This should be easy. Cutoff for Category 1 in 2024 was 403 marks for general category and cutoff for Category 2 was 386 marks in 2024. CGHS seems to be in more preference than railways for higher rankers. Now let's discuss about your life after joining. In all services, the payment will be same. You will be joining in level 10 with a basic pay of 5600 rupees. With all the other allowances, your total salary will be on the range from 96,000 to 1,14,000. This difference is based on your HRA. After deduction for tax, pension, etc., your enhanced salary will be around 86,000 to 88,000 initially. Now that the new pay commission is in motion, your basic salary is expected to, like your total salary is expected to rise around 20 to 25,000. So that is a good news. Your duty hours will be fixed. In CGHS, it is from around 8 to 2. In MCD, it is from around 9 to 3. And from railways, it is from around 8:30 to 3:30. But keep in mind that in railways, there will be additional occasional emergency duties, unpaid duties, etc. Now, the most common question, will you get your home postings? It depends on the vacancies. Sometimes you may, but I think you should be prepared to move out of hometown if you get posted somewhere else. And next question, can we get transfers? Yes, you can, but it will take some time to materialize. If you have any priorities, like if you have spouse quota, disability quota, etc., the chances of getting transfer is more. But still, according to my experiences, transfers here can take some time. I was transferred from Eastern Railway to Southern Railway, but you should be ready to wait if you are posted somewhere else. At the end, it depends whether the vacancies are available or not. You will get all of the benefits like pension, comprehensive health coverage, good housing or allowances, and there is a job security. There is time-bound promotions to higher grades. All in all, UPSC CMS provides you with a good non-toxic working environment with decent salary and other perks. If you have any doubt, you can always reach out to me through Kshipra. The link is attached in the description of this video. So, thank you guys.